Good day, everyone. Welcome to Teacher Julie channel. Hello, everyone. We have our new lesson in Mapeh 7 for physical education and health, which is all about immediate and temporary care given while waiting for medical assistance. This will be the fourth quarter topic and learning competency number 1. This lesson is under the MATATAG curriculum. The objectives by the end of the lesson, 80% of the learners will be able to. First is to identify the key steps in providing immediate and temporary care while waiting for medical assistance. The second one is to perform basic first aid procedures such as applying bandages, controlling bleeding, and positioning the patient. And the third one is to maintain professional and ethical standards when providing immediate care by answering the reflection of learning. In activating the prior knowledge for the short review, the students will write T if the statement is true and if the statement is. The following are to-dos in giving first aid. So the first one is to remain calm. The second one is to provide reassurance and comfort to the victim. The third one is to keep the victim covered to minimize the shock. And the fourth one is to look for a medical bracelet indicating a condition like epilepsy or diabetes. The following are don'ts in giving first aid. So the first one is to avoid giving food and drinks to someone unconscious. The second one is to refrain from moving an injured person unless it is necessary to position them in recovery position. First aid is immediate and temporary care given to a person who suddenly gets ill or injured. Includes self-help and home care if medical assistance is unavailable or delayed. It can mean the difference between life and death in extreme cases. However, we must know the limits of the first aid and we can give because improper first aid can do more harm than good in some instances. Anyone who gives first aid is an first aider. The following are the rules of first aid. So the first one is that it is a bridge that fills the gap between the victim and the physician. The second one is that it is not intended to compete with or to take the place of the service of the physician. And the third one is that it ends when the service of the physician begins. The following are the objectives of first aid. So the first one is to alleviate suffering. The second one is to prevent added or further injury or danger. And the third one is to prolong life. The following are the characteristics of the good first aider. So the first one is gentle, does not cause pain and panic. The second one is observant, it notices all signs. The third one is resourceful, so makes the best use of things at hand. The fourth one is tactful, so do not frighten the victim. And the last one is sympathetic, it comforts and reassures.